Yeah, thanks ever so much. You gave me this opportunity to present myself in this international forum for promoting the homeopathy. In my last presentation, I discussed some cases and basic introduction about the way I approach for the case taking and how I deal with the patients. In this presentation, I would like to give some basic introduction about the organon of medicine, which is also considered as the Bible of homeopathy. So this was uh, written by Dr. Samuel Frederick Christian Hahnemann in his lifetime. So this is the 6th edition of the organon of medicine, which I will discuss some aphorisms, which were published late after the death of Dr. Hahnemann. It has been translated by Dr. William Borick. So I'd like to go through the first aphorism, which says about what should be the mission of a physician. So he says that the mission of the physician is to restore the sick to health. Yeah, so that's the sole mission of the physician, and to establish a cure which is rapid, gentle, and permanent, and based upon the easily comprehensible principles. Okay, so I was discussing about the first aphorism of the organon of medicine, which says that the prime and the sole mission of a physician is to restore the sick to health, and the cure should be rapid, gentle, and permanent based upon easily comprehensible principles. And the basic principle of homeopathy I discussed last time as well, which is based upon the law of similars. So similars means let likes be treated by likes. So I can give you the crude example of that one. For example, there is a contest is being taken place in a hot country, and the participants are going to be from all over the world. And the temperature in that country is about 40 degrees centigrade. So the participants who are coming from the Alaska or northern regions where it is very cold, so to enable them to adapt to the situation, so they will have to train themselves in a hot country in order to withstand the temperatures or whatever the condition in that country where the contest is being taken place. So the same way, so the law of similar takes, that, for example, let the poison kills poison. Yeah. So in order to treat diseases, so we have to create something within the body which is similar to the sufferings of the patient. So that's in basic terms. So, and in order to start the treatment, the physician should know what is to be cured in each individual case. So he should know. He should also have the knowledge of what is curative in medicines. And in order to do that, so what is curative in medicine? So this is what Hahnemann did. That he first he accidentally came across the sentence in Coulin's Materia Medica, where it was shown that the cinchona bark treats malaria-like symptom because it has got the power to produce malaria-like symptoms in healthy human beings. And so he tested that statement, verified it upon himself and others also. And when he established the truth of that sentence, he tested the other medicines which were prevalent at that time in order to elicit the curative powers of those medicines. And he recorded those signs and symptoms which he was able to see it in healthy human beings, upon which these medicines were tested, and he compiled the materia medica of each medicines. And when the patients came with the similar set of symptoms which each medicine has been able to produce, so and then when it was given to those patients, the patient used to get cured. So that was the basic principle he used at that time, but he refined his art of administering the medicine later on by, for example, even though he was at that time, he was using the crude medicines to begin with, but he still found, although he was using the principle of homeopathy, the law of similars, but still he wasn't able to maintain the cure, which was long lasting, and he was still experiencing the side effects as well. So in order to find a solution for that, he started reducing the dose of the medicine which he was administering to the patients, and thereby he noticed that the more he diluted and the better the results were of the curative powers of the medicines. So ultimately, he went to the extent that he diluted the medicine. There are two scales on which he used to prepare the medicine: the centesimal scale and the decimal scale. The centesimal scale, where one part of the substance was mixed with 99 parts of the inert substance, which is either going to be sugar of milk or the alcohol, the 99% alcohol. Then used to do the succussions and then the raise the potencies up to 30 or 12, whatever was being made at that time. And he noticed that the more he diluted, the better the results were. And so the organ of medicine also mentioned that once we've got the knowledge of what is to be cured in an individual and what is curative in medicines, so we have to adapt this information in order to select a suitable remedy, which would become an indicator medicine for an individual, for a patient. And we should also, as a physician, we should also know what are the obstacles in the cure or in the recovery of the patient, and we should also know the when to repeat that medicine. So discussing about the obstacles to recovery, so there could be various circumstances which can hinder the progress of recovery. For example, a patient who is being treated for malaria and is still living in a marshy conditions, then the cure is not going to be effective. So in order to establish that, he has to be removed from those conditions which are maintaining his disease condition. So in order to effect the cure. And similarly, there could be some mental states as well supposing a person, a patient is living in an environment where his mentality, or he hasn't been able to retain his healthy mind, then in order to establish the care, he has to be removed from those conditions for the medicine to be effective. And the doctor or the physician, he should be the unprejudiced observer, and it takes into the changes in the diseased individual about the body and mind from when he was in health. And these changes are felt by the patient and also observed by the physician, and also remarked by the those people who are near, or the friends and relatives are also. And so in order to get the pure disease picture, the physician should not and would not ask leading questions to the patient. So whenever the patient, the doctor asks a question which leads the patient to answer in yes or no, so you can 100% be sure that this is not the true answer, or this is not the correct answer which the patient is giving you. Yeah, so he is giving you yes or no to please you or some other circumstances. So I discussed about the maintaining causes in order to establish the cure, which has to be removed. And similarly, the exciting causes as well, if they are present, so they need to be removed. And once where there are no exciting causes, where there are no maintaining causes, which are leading into the present morbid state of the patient, then you are left with nothing but the pure and outward morbid state of the internal disease. So this is the outward manifestation of the internal disease, or the internally deranged vital force. And this is the only way by which the disease manifests itself, by the signs and symptoms. And in order to remove that disease, the outward manifestation of the internal disease, so we will have to we will have to find out a drug picture which has got a picture which is similar to the outward manifestations of the disease in question. So in health, the vital force, which is also called as the dynamis, or the vital energy, which gives life to the organism and also maintains the harmonious operations of all systems and functions within the body. But in disease, when the vital force is deranged, or the energy or the dynamis is deranged, then it manifests itself in the form of morbid or abnormal signs and symptoms. And in order to establish cure, the physician, his sole job is to restore the harmony, or the harmonious functions of the vital force, or the dynamis, and thereby all the systems and the functions within the body operate normally. So these are the basic principles I've covered at this moment. I can just give some examples from within my practice where I have been able to apply these principles. I came across a lady who was suffering from the eczema all over. And it was the skin was it was just a raw skin, and there was a gluey discharge all over. And she came to me, which was covered from head to foot. And upon taking down all the symptoms, etc., whatever I could, and it looked like a case of the graphites. So I gave her graphites, but she did mention about a relief for some time, but the condition would recur back. So then on her second visit, I found that she has got an IUD, which is intrauterine device to use for the as a contraceptive. And so which has got the plastic and the copper as well in that IUD device. So I could, it was just a guess that it could be due to allergy, or body is not reacting well to either the plastic or the metal on that IUD device. So I asked her to get it removed, and after that, so there was a speedy recovery of the eczema which she was suffering from. So this is what I'm saying, that if a doctor is able to find out, so what is the exciting cause or the maintaining cause within a case in front of you, so you are able to speed up the process of recovery much fast. Yeah, I also have got the patient which was complaining of the chest pain. The chest pain, he got all the tests done, the MRI, the ECG, but there was nothing wrong with him. The only complaint was that whenever he goes upstairs, and only then there's a pain. And upon asking about the location of that the pain, and he would just point out with the one finger. So I asked about whether the pain radiates anywhere or not. So he said this is where the pain is located, even though he's running or going upstairs fast. And based upon that symptom, because this is the peculiar symptom of calibichromicum, so I gave one dose of calibichromicum, and the patient was healed. He didn't have to go any further tests or etc. or hospitalization at all. So in other words, the one symptom that covered the totality of the case. Okay. So recent case with me. So a person who is he said that I've got too much expectoration, and he can't speak. So uh, whether it's hoarseness or not, but he said I can't speak in the morning because of the expectoration. And I asked how long it has been going on, and he said for about 18 years. Hmm? And he's have been through all the tests, for example, the MRI, these X-ray scans, etc. They couldn't detect anything no abnormal within those scans. And he said that he was subjected to the TB treatment, the tuberculosis. And I asked, why did they subject you to the tuberculosis treatment? And he couldn't answer. He said, this is what the physician gave me. Hmm? And I asked if were there any uh, temperature, high fever you were experiencing, any night sweats you were experiencing? He said no. So these were the only symptoms which upon which I had to make a decision that what can I give. So it's I haven't given him because I'm going to take give him the medicine this Sunday. So which is the arsenicum alb. I've decided that that's what I will give him because he was feeling weak, and there's a breathlessness upon going upstairs or climbing stairs. So sometimes it is easy that the patient they reflect their case history in a manner that you don't have to exert. The doctor don't have to put that much effort in finding out the symptoms. But sometimes you are left with no option. But there's just a couple of symptoms. That's what the patient says, and this is where we have to make the prescription based upon those symptoms. Uh, there was another child who came to me, the female child and a male as well. Both have got the similar complaints. So when they urinate, so there is a burning pain in the urethra. So no other symptom apart from the boy who was about 6 or 7 years of age, that the boy could whenever he travels in a car, so he's got the he has to open all the windows of the car, otherwise he will vomit or he will feel nauseous. So the boy I prescribed Coculus, and he's fine with that. I didn't have to repeat any other medicine for him. But the girl, I prescribed Canthris, and she's fine thereafter as well. All right. All right. There was another patient who he was he recently retired, and while he was traveling, and he experienced that the right hand side of the face, he there was something abnormal he experienced, and he said he couldn't see it through the right eye in a normal way as well. So I on further interrogation, I couldn't do it at that time, but when he came back home and then he rang me, that's what happened. So the doctors told him that this is a case of stroke. So he was first subjected to the steroids, etc., and which he found it very little relief. Yeah, and ultimately I gave him belladonna based upon the fact that he was traveling in a bus and it was cold outside, the window was open, so the cold draft he was exposed to, and thereafter, so he experienced this abnormal sensation in the right hand side of the face, and the distorted images in the right eye as well. So that one dose of 200 belladonna, so it set him right, and he's fine with that case as well. Are you ready? Okay, I would like one of my testimony to provide some of our experiences in front of you, please. Okay. That's Dr. Prithpal Kaur.
Hello, my name is Prithpal Kaur. My background is in science, particularly chemistry. For many years, I had always used allopathy for all types of ailments, as I had known and nothing else, particularly for colds, coughs, and flus. These medications included paracetamol, Benylin, amoxicillin, and usually my recovery was quite long, sometimes 1 week, sometimes 10 days, particularly with influenza. I also had some side effects with amoxicillin too. Then when I started using homeopathy for ailments such as colds and flus and coughs and so on, I recovered much more quickly with no serious side effects, no side effects at all, in fact. So overall, using homeopathy, both the duration and the frequency of the colds, the coughs, and the flus was reduced. Yeah. A few years ago, I slipped and fell onto a concrete floor, landing on my right side. And from the advice of the homeopath, I took 1 dose of arnica. And then I went to the nearby A&E department, accident emergency department at a hospital, to get checked out in case I had fractured any of my limbs. And when the physiotherapist checked me out, he said all the limbs are fine, but he gave me a pair of crutches to use because I was limping very badly. And then he suggested also to take some ibuprofen. But I said to him that I had already taken some arnica and I was feeling a little bit better. And he hadn't actually heard of arnica, so I explained that to him. And he said that I should come back in about a month and a half time, and bring back the crutches as I will no longer need them. So my immediate reaction was, do I need to use crutches for a month and a half? Anyway, I went home and under the advice of the homeopath, I took some Rustox, and it was quite clear that I had stretched ligaments in my leg and also in my arm too. And I started to feel better. I was limping less, and gradually over about 7 days, I was walking upright. So then I went back to the hospital to return the crutches. And the physiotherapist, same physiotherapist who treated me earlier, was very surprised to see me back so quickly. He said, "Oh, I was expecting to see you back in about a month and a half time." I said, "Well, I have, I'm fine." And he asked me what I had taken, and I said, "Well," I told him what I hadn't taken, but I explained to him about homeopathy, and he had never heard of it. But my recovery was quite fast. And I also mentioned that I didn't use the crutches either, so that was a good thing. In addition to these experiences, a few years back, I had a few short spells of vertigo, and after visiting my GP, who recommended, I should say, that I use a few drops of olive oil in my right ear, I decided not to do that, and I took some homeopathic medicine for my ear, because I think the ear is involved in balance, and so I assumed that a medicine that would restore the balance in my ear would be good, and I felt so much better. Overall, my experiences with homeopathy are that it's safe, it is harmless, it is very gentle system of medicine with no side effects, and the recovery time is so much faster. Where currently, scientists don't fully understand what is happening at the molecular level with regards to homeopathy. But if the patient recovers fast or recovers very well or feels better, then that's good for the patient. It's all to do with patient recovery and feeling better. Understanding whether something how it operates at the molecular level is purely an academic exercise. So I would strongly recommend homeopathy. It's underrated and it's undervalued currently in most countries of the world. So having worked within the pharmaceutical sector, within the research and development side to drug development, I can safely say that rather than sitting there, chewing away, milligram quantities of various drug substances, that we should try to encourage the use of homeopathy to patients and generally to the wider public, as it's so much safer and is much more gentle. It's huge, is relatively inexpensive too, and currently within the NHS, I think they could benefit enormously. Particularly, for example, if you go to A&E departments, and I've had a few visits there myself. A&E departments are currently, very, very busy, and if we had a homeopath clinic there, then it would be useful, because patients, whilst they're waiting 1 hour, 2 hours, 3 hours, 4 hours, 5 hours, or however long, if they were able to see a homeopath before they get to see, say, I don't know, a specialist in whatever, orthopedics or whatever, bones, they could see a homeopath, then they might, recover anyway. They might be discharged much more quickly without having to see any so-called specialist. So I would strongly recommend homeopathy. And yes, I also used homeopathy when on another occasion, whilst I was expecting my son, I used homeopathy, and it was very good, especially with regard to pain relief towards the end. So it was very, very good. So are there any questions? Any questions? Anyone? I won't be able to answer any homeopathic questions, but I can answer anything to do with chemistry, as that's my subject. Okay.
Thank you, madam, for your testimony.
Yes, okay, thank you.
Thank you very much. So I'm just going to give 2 more cases, the father and the son. The father I treated recently about the toothache. So there was one was the wisdom tooth and the 2 molars on the lower jaw. And he was having a pain as soon as a warm drink or cold drink touches the teeth, he was experiencing pain. And the pain was dull, aching pain, lasted all the time. And it also used to aggravated by chewing. So he went to the dentist first, which they suggested that you should have the root canal treatment done on all these 3 teeth. So, but he couldn't get the appointment soon. So in the meantime, I intervened and I asked him to take belladonna first and followed by Merck Sol 200. So I asked him to alternate on a 2-hourly basis. So this was done on first day. The next night when he woke up, the pain was nearly gone. So I asked him to take just one more dose of Merck Sol 200. And today I found that he was absolutely fine, no pain at all. And hopefully he will be all right. And I treated his son as well just about 2 weeks ago. And he had the pain in the knee, right knee. And when he was cycling, and at that time, when he used to put pressure on the pedal, that's the time he was experiencing pain. And he was on a tour from Chandigarh to Kanyakumari solo bicycle ride. And he wasn't sure whether he will be able to make it or not, and because he was experiencing pain in the right knee. So when he phoned me, I asked him to take arnica one day, arnica in the morning, rustox in the evening, and followed by next morning by iruta, because I suspected that he has put too much strain on the knees during the first leg of his journey. So it carried on for about 2 days. Then ultimately the pain get reduced and reduced and reduced, and ultimately it is all gone now. So there was so it took him about 45 days to travel from Chandigarh to Kanyakumari. So there was one more occasion when the pain relapsed. So I asked him to take the another dose of arnica, rustox, and ruta. And so he finished his solo bike ride successfully, came back home, and he was very pleased. Okay, that's the end of my presentation.